want to take notes. Let's get started. The B in Bright Minds is for blood flow. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease and is also associated with depression, ADHD, and schizophrenia. When I first scanned my niece Alize, it showed lower overall blood flow, which is very concerning given her age. But seeing it gave her incentive to really care about her brain, and on supplements, medication, and a healthier diet, over 6 months, her brain was healthier, and she felt better and excelled in school. In fact, she won multiple academic awards and was her 8th grade graduation speaker. Research shows that brain cells don't age, but rather it's your blood vessels that age, and anything that damages blood flow damages your mind. So how do you keep your blood vessels healthy? Exercise is critical to maintaining healthy blood flow. It's the universal psychiatric treatment. Hippocrates was right. Head-to-head against antidepressants, exercise has been shown to be equally effective. Limit caffeine and nicotine as they both lower blood flow. Keep your blood pressure healthy. As blood pressure goes up, blood flow to your brain goes down. Plus, protect your heart, as any form of heart disease can damage your brain. If I was an evil ruler and wanted to damage your blood flow, I would create a culture where people have to have caffeine in the morning and throughout the day to feel alert, and alcohol at night to come down, both lower blood flow. If I was a good ruler, I would limit video games and screen time so people would spend more time outdoors in the sunshine exercising. Did you know that bright light therapy has been shown to increase blood flow to the brain and help with mood, focus, energy, and even sleep in just 30 minutes a day? The R in Bright Minds is for retirement and aging. Our research clearly demonstrates that your brain becomes less and less active with age. I hate that. But if you work to keep your brain healthy, you can slow or even reverse the aging process. But the older you get, the more serious you need to be about taking care of your brain. Because when you stop learning, your brain starts dying. Mental exercise is as important to your brain as physical exercise. The first I in Bright Minds is for inflammation, which comes from the Latin word to set a fire. When you have chronic inflammation in your body, it's like you have a low-level fire destroying your organs. You may know that inflammation is associated with cancer and arthritis. But did you know that it is also linked to autism, depression, and dementia? There are a number of important and surprising causes of chronic inflammation that you can control, such as a diet high in sugar and processed foods. The standard American diet is killing us, making us fatter and more inflamed than ever. Get your food right, and your mind will follow. Gum disease is a major cause of inflammation. You must floss and take care of your teeth. Low levels of omega-3 fatty acids are another common cause of inflammation that affects 97% of the population. No wonder we have an epidemic of brain health issues. Taking omega-3s have been found to help with mood, focus, memory, and your weight. Gut problems are also a major cause of chronic inflammation. Hey, I thought we were talking about the brain. What do the gut and brain have to do with each other? Like everything. Pop quiz. Where 3/4 of your neurotransmitters made? in your gut, which is also called the second brain, because it is loaded with nervous tissue, which is why you get butterflies when you're excited and loose stools when you're anxious or stressed. Taking care of your gut is critical to lowering inflammation and why probiotics have been shown to help your brain. If I was an evil ruler and wanted to increase inflammation, I'd put fast food restaurants everywhere. In a fascinating study, researchers looked at 2 outer islands from Australia. One had fast food restaurants, the other did not. The population with fast food restaurants had significantly lower levels of omega-3 fatty acids and 5 times the level of depression. In the program materials, Tana has more than 200 brain-healthy recipes to help you change your brain to heal your mind. Plus, notice these look amazing. There is no suffering in getting well. The G in Bright Minds is for genetics. Brain health and mental health issues run in families, the same way heart disease does. Which issues run in your family? But unlike what most people think, genetic risk is not a death sentence, as in the case of Alizé anomaly. Rather, it should be a wake-up call to get serious about your risk factors as soon as possible. You might know my friend Lisa Gibbons. Her mother and grandmother died with Alzheimer's disease. When she was 51, she came to see us because of severe stress. Her SPECT scan showed very low overall activity, which was consistent with depression and the potential of Alzheimer's in her future. SPECT can tell years before people have any symptoms if they're likely to get dementia. But Lisa did everything I asked, and 10 years later, her brain is dramatically healthier. Would you like a better brain a year from now? 5 years from now? How about 10 years from now? Know all of your risk factors, including the genetic ones, and be serious about prevention as soon as possible. Plus, think about screening your brain. When I turned 50, my doctor wanted me to have a colonoscopy. I asked him why I didn't want to look at my brain. Wasn't the other end just as important? As a society, we screen hearts, bones, breasts, and prostate glands, but very few people ever look at their brains. In the future, that will change. The H in Bright Minds is for head trauma. Mild traumatic brain injuries are a major cause of mental health issues, and few psychiatrists know about it because they rarely look at the brain. Your brain is soft, about the consistency of soft butter, and your skull is really hard with multiple sharp bony ridges. Head injuries, even ones that occurred decades earlier, are a major cause of depression, addictions, and memory problems. Meet my friend, Gary Busey, the Oscar-nominated actor who had a serious motorcycle accident in 1988, where he was in a coma and had a near-death experience. His brain showed serious damage, with decreased activity in the front part of his brain affecting his empathy, judgment, and impulse control, and in his temporal lobe, so he had trouble reading social cues. This gave him problems in his marriage and work. Gary wanted to save his marriage and keep acting, and by doing the Bright Minds interventions I'm giving you, he's lost 40 pounds, improved his impulse control, and marriage. At the age of 76, he recently appeared in an off-Broadway play as God. It turned out one of the most important parts of Gary's story was scanning his wife, Stephanie. She had struggled with moodiness and irritability, which was only exacerbated by Gary's erratic behavior. It was easy to blame Gary, but our brain imaging work taught me that everyone's brain contributes to the family dynamics. Stephanie's brain showed trouble in her frontal and temporal lobes, likely from being thrown off her bicycle when she was hit by a car at the age of 6. Rehabilitating her brain with supplements, hyperbaric oxygen, and the Bright Mind strategies played a major role in improving their marriage. Get your brain right, and your family will be better. If I was an evil ruler, I'd encourage distracted drivers like the one who hit Stephanie. Stop it. I'd invent evil ruler games such as Running with the Bulls, where stupidity and death wishes run together to create brain damage. And I'd require older people to get up on ladders to clean out their gutters, as falls are one of the most common causes of brain trauma in the elderly. It's okay to hire young people to do that. If I was a good ruler, I would create coordination and strength training programs for the elderly. They will be less likely to fall, and the stronger you are as you age, the less likely you are to get Alzheimer's disease. The T in Bright Minds is for toxins, one of the most common causes of brain and mental health issues. When I first started performing SPECT scans, I noticed a toxic pattern on the brains of substance abusers. But the scans also taught me that there are many other things that damage your brain, such as exposure to mold from water damage, carbon monoxide, common in firefighters. Jared has to be careful to protect his brain. Pesticide and toxic chemical exposure, and even anesthesia, which has shown an increased risk of learning problems in children and dementia in adults. Here is a scan of my assistant Karen before and after general anesthesia to have an aortic aneurysm repaired. She could tell how much it affected her mood and memory. But when we worked to fix the damage, her brain was much better over the next 6 months, as was her memory and focus. Of course, you can't always avoid anesthesia, so we should always be taking care of our brains. One detoxification strategy I really like is taking regular saunas. Research has shown that people who take the most saunas have the lowest risk of Alzheimer's disease. Other researchers have found it to be an effective treatment for depression. The M in Bright Minds stands for mind storms, which is abnormal electrical activity in the brain that can cause mood instability, irritability, temper problems, anxiety for little or no reason, memory and learning problems, and often headaches triggered by fluorescent lights. This is one of the reasons psychiatrists use anti-seizure medications for patients with bipolar disorder, anger management issues, and migraines. They help to stabilize the brain. Mind storms often come from the emotional part of the brain in an area called the temporal lobes. A few years ago, I met Tommy, a 9-year-old boy who had read my book, Change Your Brain, Change Your Life. When he first saw me, he said, "Hey, Dr. Amen, I have a left temporal lobe problem." "Really?" I asked. "How do you know that?" He said, "I read your book." "But how do you really know?" He said, "I have a really bad temper, and you write that people who have bad tempers often have temporal lobe problems." He was right. And then he added, "And I used to see ghosts." "What?" "I used to see these green things float in front of my eyes. I thought they were ghosts and they would scare me until I read your book and realized they were illusions that come from misfiring temporal lobes." And then he looked at me with his big, beautiful blue eyes and said, "And last year, to get rid of the bad thoughts in my head, I tried to kill myself." Tommy's scan showed a problem in his left temporal lobe, as he predicted. A long time ago, I realized not everyone can get a scan. So based on thousands of scans I developed checklists for you to know about the health of your brain, including which of the 16 brain types you have. For mind storms, people often respond quickly, like Tommy did, to treatments such as anti-seizure medication, a very low carbohydrate diet, which is not good for everyone. You have to know your brain type, and a treatment called neurofeedback, where we trained his brain to fire more normally. So far, we've talked about the first 7 Bright Minds risk factors. In the program materials, I also talk about immunity and infections, like Lyme disease, which we'll talk more about, neurohormone deficiencies. Thyroid and testosterone must be optimal for your brain to work right. Diabesity, which is a combination of high blood sugar and being overweight. Both of these shrink your brain. And sleep problems, such as insomnia and sleep apnea, which can damage your brain. You must make sleep a priority. When we come back, I'll tell you about a couple who benefited